Hello everyone, here we are going to discuss a very important topic, that is jaundice. In your university exam, very frequently you get a long question on jaundice. So you get long question on one of the three type of jaundice, either prehepatic, hepatic or posthepatic jaundice. That is hemolytic jaundice or hepatocellular jaundice or obstructive jaundice. So we will be discussing all three these jaundice in detail here in this session. So let's start the topic. Jaundice. So let's start the topic jaundice. Okay, so first of all, let me give you an overview under the headings under which I'm going to discuss this session. First of all, I will let you know the introduction. In the introduction, we will see what is jaundice, what is hyperbilirubinemia, then we will see the definition of jaundice. Then we will see the normal bilirubin metabolism, how bilirubin is synthesized, what is the hepatic phase of bilirubin, what is the intestinal phase of bilirubin. Because if you don't understand the bilirubin metabolism, you cannot understand the types of jaundice. So first we will see the bilirubin metabolism, then we will see the two types of bilirubin, that is unconjugated bilirubin and conjugated bilirubin and the differences between them. Then finally we will come on the classification of the jaundice. So here I will discuss two different type of classification in detail. The first classification of jaundice is prehepatic jaundice, hepatic jaundice and posthepatic jaundice. The prehepatic jaundice, which is known as hemolytic jaundice, the hepatic jaundice, which is known as hepatocellular jaundice, and posthepatic extrahepatic jaundice is known as obstructive jaundice. I will let you know why these terms are given to these type of jaundice. I will explain you everything in the pathogenesis of these. So we will discuss these three in detail. And finally, we will see one more classification of jaundice, that is unconjugated hyperbilirubinemia or conjugated hyperbilirubinemia. And finally, we will see the differences between intrahepatic versus extrahepatic cholestasis. So let's start the topic jaundice. Now, in your university exam, if you are getting a long question on jaundice, you have to write down everything. Okay, depending on the marks. But if you are getting a short question either on one of the type of the jaundice or the type of the bilirubin, or you can get a question on intrahepatic, extrahepatic cholestasis or the unconjugated or conjugated hyperbilirubinemia, you have to write down that particular portion only, depending on the marks. Okay, so let's start the topic jaundice. So first of all, let me give you the introduction of jaundice. What is jaundice? So first thing I would like to say, jaundice is not a disease. It's a symptom. You can say it's a sign rather. So it's a sign. It's not a disease. For example, fever. Is fever a disease? No. Fever is not a disease. So fever is a symptom. Fever can represent various underlying disease. The patient can have fever due to typhoid. The patient can have fever due to malaria, due to COVID, due to various reasons. Okay, due to dengue, due to various reasons. So the cause of the fever can be anything. So these are the causes of fever. But fever is a symptom that represents some underlying cause. So fever is not a disease. It's a symptom that represents some underlying cause. In the same way, jaundice is not a disease. The jaundice is a sign that represents some underlying disease. Some underlying disease is there. So first thing I would like to say, jaundice is not a disease. It's a sign that represents different diseases that is seen in different diseases. So what is jaundice? In jaundice, there is hyperbilirubinemia. What do you mean by hyperbilirubinemia? Split the term. Hyper means more. Bilirubinemia means bilirubin in the blood. So basically there is increased concentration of bilirubin in the blood. Okay, I will tell you there are two types of bilirubin, conjugated and unconjugated, based on which there are two types of hyperbilirubinemia, conjugated hyperbilirubinemia and unconjugated hyperbilirubinemia, that we'll see later on. But ultimately, whatever it is, whether conjugated or unconjugated, if bilirubin is raised in the blood, so basically the bilirubin pigment have a high affinity for the elastic tissue. So in human body, from head to toe, where is elastic tissue? Elastic tissue is present in entire skin. So bilirubin present in the blood will bind to the skin, the elastic tissue of the skin. And the elastic tissue is present in the sclera of the eyes. So bilirubin will come and bind with the sclera of the eyes. So whenever, this is a blood vessel, whenever the bilirubin concentration in the blood is high, that is known as hyperbilirubinemia. So this high concentration of the bilirubin bind with the elastic tissue. Elastic tissue present in the skin. So it will bind with the skin and it will be present in the sclera of the eye. So it will bind with the sclera of the eye. So skin and sclera look yellow in color, and that yellowishness is known as jaundice. It is also known as icterus. So jaundice and icterus are synonym. They are same. So that is yellowish pigmentation of skin and sclera. So have a look here. The skin is yellowish in color. Have a look here. Can you see the sclera? The sclera, don't look the conjunctiva, see the sclera. The sclera is yellow in color. So that is jaundice or icterus. That is yellowish discoloration of skin and sclera. Can you see the yellowish discoloration of skin and sclera?